الحمد لله رب العالمين صلى الله وسلم وبارك على نبينا محمد وعلى آله وصحبه وسلم تسليما كثيرا أما بعد. So I want to welcome all of you for being here with us this evening, inshallah ta'ala. We're discussing a very special topic. SubhanAllah, when I was thinking about the subject, part of it is because I want to educate myself as well, because I have a lot of allergies. And then especially living here in the Dallas area, SubhanAllah, it's known to be a very heavy, concentrated area with a lot of allergies. And as a result, every year around that same time, spring, and then you have it in the fall, a lot of people start complaining about the allergies. And subhanAllah, we had a break from the allergies a little bit because of the cold weather for the past few days. So it's kind of like dissipated and disappeared. But it's going to kick back again soon as the weather starts getting warmer and warmer and warmer. A lot of people, they wonder what's the meaning of it, how it's happening, why this happens, and a lot of questions. People have a lot of questions in their mind in regards to the subject of allergies. So we wanted to talk about this from a medical perspective, from a health, holistic perspective, and also from a seerah and historical perspective, inshallah. That's why we dedicated this session to, and we called it the Sunnah of Dealing with Allergies. If it happened at the time of the Prophet ﷺ, how did they deal with it? What did they talk about? How did they handle the situation? We're going to discuss a few things from the Sunnah of the Prophet ﷺ, inshallah. But first, we're going to talk about it from a medical perspective. What are allergies, where it's coming from, how it happens, and what are the common things here in the Dallas area? And also, what are the common medicine, as a matter of fact, or medications people use to treat the allergies? So that's why we have here with us, inshallah ta'ala, a Dr. Mushfiq Shikdar, who's going to be talking about this area. And then from a holistic, medicine, or could say alternative medicine, we have Sister Noor Salim. She is speaking to us, inshallah, through video conferencing all the way from Michigan. And she's specialized in the field as well. And she's the author of the book, the Sunnah Superfoods, from the Sunnah of the Prophet ﷺ, recipes from the diet of the Prophet ﷺ, hopefully give us, the ability and the idea to live a healthy life, inshallah, azza wa jal. And then we're going to talk about it from the seerah of the Prophet ﷺ. And that's where we talk about it from the Sahaba radiallahu ta'ala anhum when they moved to Mecca to Medina, what happened to them, and how did the Prophet ﷺ treat those who fell ill when they moved to Medina. This is going to be a discussion, inshallah ta'ala, tonight, binillah azza wa jal. And with that, we'd like to start with the first part of it, the medical aspect of allergies. So the question many people they ask is, what are allergies? What causes allergies, and how do people should treat them? And from a medical perspective, what do people do? So here we have, alhamdulillah, with us our one of the local doctors we have in our community, Dr. Mushfiq Shidkar. Did I pronounce it right? Naam, jazakallah khair. He started actually his medical education first in Dhaka, Bangladesh, and then he moved here to the U.S. where he obtained his bachelor's degree in biological science at Columbia University in New York, and then he has his Doctor of Medicine degree from the Ross University School of Medicine. Alhamdulillah, he completed a lot of, mashallah, degrees and residency in Brooklyn, New York as well. And here we have him, alhamdulillah, as one of the resident doctors we have in our community. So, Dr. Mushfiq.
Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khairan, Sheikh Yasir. So basically, inshallah, I'm going to try to keep it very simple and to the point. So first thing, what is allergy? So basically, when we all of us at some point of time, or sometimes, maybe most of our lifetime, we suffer from allergy. So allergy is a reaction in our body. So our body has some specific cells. And those cells, when they come in contact with some kind of allergen, they're the incells, okay? And those cells secrete some specific substance, and that substance trigger some immunologic reaction in our body, and that's how the whole thing starts. So the allergy can be due to infection versus just pollen or any other insults causing the allergy. So a lot of times we have, nasal congestion, runny nose. In medical time, we call it rhinitis, meaning inflammation of the nasal area inside the nose. Would have been nice if we could show you the pictures, but it's okay. I'll try to explain and keep it simple. So lot of us suffer from rhinitis, sneezing, red eye. We feel itching in our throat. Runny nose. All these symptoms. It could be associated with viral infection. That's the most common cause, actually. One of the most common cause of upper respiratory infection. Okay. And when you talk about allergy, basically, a lot of times it is triggered by some substance that our body, cannot tolerate. So one of the most common thing is allergic rhinitis. And how do you treat it? A lot of times you see over-the-counter antihistamine, like Benadryl helps. So there are two types of antihistamine. One is called non-drowsy and drowsy formula. So Benadryl is available, but it can cause drowsiness because it can cross our blood-brain barrier in the brain, and in that way it can cause, make you sleepy. There are new generations. Those are non-drowsy, like Claritin, Jartec, or Cetirizine. Then we have Allegra. So those are non-drowsy formula. But every individual is different. Even with non-drowsy formula, some individual can still feel drowsy. So so if you have symptoms, and you need relief from the symptoms, you have to use some of it. And a lot of times they come intranasal. You can use intranasal solutions to help you. So they're local. You do not have that much of systemic effect of this medication. You can use tablet forms. So these are the things available. The next step that I'm going to talk about, the seasonal allergy. So seasonal allergy is a broad topic, and especially when you talk about seasonal allergy, especially in Texas, is very well known. So in Texas, throughout the year, you have so many different things that can cause the problem. So I have a slide that shows Texas Allergy Calendar. We're going to see it shortly. So before we can put it on, I'm going to talk about the most common allergen in Texas. So the number one that comes in our mind is the oak pollen. So basically, during the springtime, when the winter is over, we are almost going towards the springtime. So it is most prevalent, the oak pollen, and it can give you almost the similar problem that you have with any other allergy. Itchy, congestion, itchy nose, itchy throat. All these things can happen. And the second one is the grass. So grass. Basically, the allergy to the grass is throughout the year. But as you know, in winter time, grass allergy is a little bit less because of a lot of grasses are dying. They become yellow, so it is a little less. But in summer and fall, they can be very prevalent. But basically, grass allergy can happen throughout the year. The next one that is common in Texas also is called Cottonwood. It can come in late spring, and it can cause similar problem. And you can, and some people can be very suffering very severely from cottonwood as well. The next one we have in Texas also common is called ragweed. It usually peaks in late summer or early fall, and every individual will have different symptoms. Some individual may suffer more than somebody else. And basically, the symptoms relief will depend on, how used to you are, whether your body is getting used to it over many years of exposure, whether you have preformed antibody to your system and that is reacting to it immediately. So a lot of factors that involve. The next one we're going to talk about is called mountain cedar. So that can be very severe. It can almost mimic flu-like symptoms. People can have fever, body aches, lethargic, so almost like viral illness, but it can be confused. So, but it is actually mountain cedar that can cause this problem. And there's something specific about this that is available. It's called a specific drop and nasal also inhaler. It's called cedar drop solution. A lot of times it is sold over the counter. Also, you can get some organic, whole food store. You can get it. But overall, most of these allergic reactions and the symptoms can be treated day-to-day basis with the very common medications that we talked about, like antihistamine, which is Benadryl, first generation, or second generation, newer generation, non-drowsy formula like Allegra or Claritin or Zyrtec, things like that. You can have nasal spray, nasal corticosteroid like fluticasone or Flonase. Those are available too. So that's basically important for people who are living in Texas. And Texas is well known for allergy compared to other states. And as you can see, it can happen throughout the year. Fall, spring, late spring, winter. So there is no specific solution or ultimate solution to these problems. You can suffer at some point or a little bit milder throughout the year. I'm going to talk about very briefly about some of the allergic reactions that we should all aware, and that can happen to almost all of us. And in fact, it may have happened to almost all of us at some point of our life. One of them is called urticaria, U-R-T-I-C-R-I-A, urticaria. Sometimes you can see suddenly you are waking up or you are just having a normal lifestyle. Suddenly you start with itching and swollen, red bump on your skin. It can be triggered by latex. It can be triggered by insect bites. It can be triggered by some specific metal. Some people are allergic to titanium. Some people are allergic to gold. So it can happen. So nothing to worry about. Basically, the management is the same. A lot of times they are self-limited. They get better. And if symptoms get worse, we can always use the Benadryl, or we can use steroid like prednisone. Prednisones are steroids. They are used in the hospital a lot. They are available in oral. They are available in injection, IV form, fast acting. So a lot of times that is used. So that's urticaria. Another not very common but very life-threatening condition is called angioedema. So angio basically means the blood vessels. Now angioedema can be due to a specific reaction because our body has some specific cells like mast cell. These are one type of blood cell that can be pre-sensitized, and when pre-sensitized to a specific allergen or trigger, and when people come across, get in contact with that, they can immediately react. What do you see? Someone who has been doing fine, and suddenly their lips are swollen to the point, they can look at the mirror and they'll be like, that's not me. It happens. We see it in the hospital, in the emergency room, very common. A lot of times people come in, sometimes they don't realize, their family members look at them and they're like, what is going on? Your eyes is swelling, your lips are swelling up, and they get panicked. They come to the emergency room. So that's one thing that is triggered. You have a pre-made antibody, and it's a quick reaction. it can also happen due to some drug. A lot of us, are using medications like lisinopril, quinapril, ramipril, enalapril. I think some of you are familiar with that for high blood pressure, for treatment of hypertension. So these medications belong to a specific group of a class of medication. They are called ACE inhibitors. And there are similar medications who do the same job like ACE inhibitors. They are also called ARB. And some of you are maybe familiar like valsartan, losartan, medications like that. They are treated for blood pressure, and they are well known to cause angioedema. And what is interesting about that is that a patient may be taking lisinopril or valsartan for 15 years, and after 15 years, suddenly they develop angioedema. Or, on the other hand, a patient started on this medicine maybe after 2 hours of taking the medications, they get angioedema, swollen lips. So why it is life-threatening? Because this swelling is not just happening in the lips, this swelling is happening inside. And as we know, our breathing tube and our food pipe, they cross right here. So if you have significant amount of swelling there, you won't be able to breathe. So it's a life-threatening condition when somebody has angioedema and they are unable to breathe. So that's a medical emergency. Sometimes you cannot even intubate or put a tube to help them breathe with a mechanical breathing machine because the swelling can be so severe. You cannot put a tube down. Sometimes they get emergent, surgery here, minor procedure, and they put the tube right away. So that is done sometimes. And what should we do about this? We just have to avoid the offending agents. So you cannot use those drugs anymore. How do you treat? Again, you give antihistamine, IV steroid, and also some of the medications that you use every day is also used for severe allergy angioedema in hospital, which is like Pepcid or famotidine. They come in IV forms, and a lot of times they are combined with steroid, Benadryl to treat this kind of problem. So these are some of the life-threatening allergic reaction that you should know. And then another most important is the anaphylaxis.
You have 3 minutes.
Anaphylaxis, which is another life-threatening conditions. You are all familiar. People carry epinephrine, right? Some people. So how it happens is somehow body has a mountain amount of reaction to allergen. And when you talk about allergen, these are the trigger, the insult. And peanut is well known, and that's why a lot of schools they even prohibit bringing anything that contains peanut because some of the kids could have serious anaphylaxis, and so peanut is one of the trigger. Some medication like antibiotic, penicillin can be a trigger. Sometimes latex can be a trigger. Some other drugs, NSAID. NSAID means every day the drug that we use, Motrin, ibuprofen, they belong to a class called NSAID. Aspirin. You see, all these medications that you use every day can cause serious problems. So anaphylaxis is a serious condition. So people who had diagnosis of this, they carry EpiPen with them. So because you have to take care of the problem right away. Oh, another important thing that is bee sting can cause anaphylaxis. So these are the overall, some basic and everyday needed and useful information about allergy that we should know and be aware of, so that inshallah we can take proper care and help ourselves as soon as we recognize something is emergency, whether something is usual, normal.
Jazakallah khair, Dr. Mushfiq, for this presentation. We do have some questions actually from the audience online as well about certain things related to the subject, but inshallah we're going to wait until the end of the presentation. Sure. We inshallah, as we get Sister Noor Salim inshallah on the screen here, live from Michigan. I just want to introduce her for you, inshallah ta'ala, her bio. So Sister Noor Salem, she is actually she's a certified holistic health coach. She's originally from North Carolina. She lives right now in Michigan. She finished her education, bachelor's degree first in communications from University of Michigan within 2 years, mashallah, and then finished her graduate degree certification as a holistic health coach from the Institute of Integrative Nutrition, which is considered the world's largest education institution for nutrition. She's, mashallah, she's very active in the community, and she's also a writer. She's the author of the book Sunnah Superfoods, a kind of a collection of life-changing recipes and remedies from the nutrition and the food and the diet of the Prophet sallallahu alaihi wasallam. So, alhamdulillah, we had her actually here with us to talk to us about the subject of allergies from the food perspective and how you can have a healthy actually lifestyle, when it comes to your diet, inshallah. So, Sister Noor, I don't know if she's available or she's ready right now. Omar? Substance that triggers our allergic reaction. Is there any way we can understand that? Yes.
Yeah, it's a very good question. So a lot of times when you go to an allergy specialist, first of all, you go to your primary, or you can go to allergy specialist right away, or your primary can direct you, and they can do the allergy test, the so-called allergy test. So they are designed in a way that has different types of allergen.
Okay.
Most of the time, like dust mite, carpet, ragweed, all these things combined, and they do it on the skin. And depending on how much reaction they show, so the skin will have a reaction, red, swollen, and they know exactly which point, what type of allergen was given. Depending on that, they can determine how much reactive you are to a specific substance.
So this is basically from dealing with specialists, but as an individual, can a person recognize what based on certain symptoms that they develop?
Yeah, you may see if you know yourself that okay, certain substance, or if I go to certain place, or if I come across to certain animal like cat or dog, that triggers my problem. Or some people may say, oh, such and such time I went to my friend's basement, I really felt bad, my eyes were red, and I was sneezing. So you know what may have triggered. Okay. And down the line, you learn yourself, like these things gives me problems.
So experience.
And you try to avoid that.
Jazakallah khair. Oh, yeah. We have another question here. Says that is there a way to prevent or cure the allergies, or is this a lifetime ailment? Like you're gonna have to deal with it for the rest of your life?
There is not an easy answer to this question. Actually, most of us, I believe, we suffer at some point throughout our life. I'm not sure up until now, to the best of my knowledge, if there is any medications that is out there that can help or eliminate this kind of problem forever, as you can see. Right? No, I don't think so. There are some specific medications, and it's still under development in research. Those are immunomodulators, specifically trigger some immune cell, and our body makes IgE. Those are some of the important immunoglobulins, a lot of times involved in this kind of reaction. So they're developing some drugs, and it helps some people, especially related to asthma and other allergic type of reactions.
I know we're going to hear from Sister Noor on the subject of diet, but do you think if people, have a certain diet that could help with that, or has nothing to do with the food in that?
It is.
Go ahead.
There's nothing specific like that. Basically, you just have to avoid
Okay.
something that is
Like
causing
some
the
people are
problem.
allergic to
Yeah.
eggs, some other allergic
Yeah.
to
The peanut, you know it.
even to
Peanuts,
bananas. I have some
bananas.
people
Oh,
bananas
yes.
and just like
And some fish too. Some people are allergic
Oh,
to
really?
fish. Shrimp, yes.
Interesting.
Some people are allergic to shrimp.
Subhanallah.
Some seafood, oh yes.
I hope there's no allergy against chocolate. Okay.
Some people may have.
Really?
Yes, there is.
Allah mustaan. Khair,
Yeah.
inshallah. Jazakallah khair. Barakallah feekum, inshallah. Guys, is Sister Noor ready? Okay, bismillah. We've already.
Assalamu alaikum wa rahmatullahi wa barakatuh. So although I couldn't hear you guys, that's why I was quiet. But inshallah, we're going to go ahead and begin. Bismillah, as-salamu ala rasulillah. It is my honor to be speaking to you guys on Sunnah tips for allergies. And jazakallah khairan to the organizers and to everyone tuning in with us today. And so I begin with a question. Actually, why do you want to live? You know, why is it meaningful to you to live a long and healthy, prosperous life? And in fact, there's an incident in the Prophet ﷺ, in which a man came and asked him, قال يا رسول الله أي الناس خير؟ قال من طال عمره وحسن عمله. He asked the Prophet ﷺ, O Messenger of Allah, which of the people is the best? He responded, he whose life is long, deep and good. So when you ask Allah subhanahu wa ta'ala for a long life, when you ask Allah subhanahu wa ta'ala to live long and for, to have, the old age, and also ask them to, be able to do good deeds. Because you can be living a long life, but say at the end of your life you're bedridden, or you're dealing with, a certain disease or, a chronic condition, leaving you not able to worship properly. Perhaps you can't go into food, or perhaps you're dealing with migraine or whatever it may be. And when you ask Allah subhanahu wa ta'ala for a long life, ask for good. And with that, it also has us asking ourselves, why am I here today? We all know our purpose here. Like our purpose is to worship Allah subhanahu wa ta'ala, in order to inshallah attain Jannah and His promise. And so that should, change your entire perspective of diet. Suddenly every single day when you're having your meal, you're waking up having breakfast, you're probably possibly going to the gym at 6 in the morning, now you have a reasoning for that, a mission way beyond life. As Imam Shafi'i rahimahullah says, it is very beautiful word of course, one of my favorite. It says, أنا إن عشت لست أعدم الخبز وإن مت لست أعدم الصبر همتي همة الملوك ونفسي نفس حر ترى المذلة. He says that if I live, I am not just food and drink. And for that, when I die, I am not just a cast body. My vision is beyond that. My vision is not just to, finish school, go to college, get married, have kids, get the best career I can imagine, and then what? Ask yourself, what is my purpose here? What am I leaving behind when I leave this? And so when you set this vision that you want to leave a legacy behind, you want to live a long, prosperous life, tying back to the hadith we just mentioned, in order to do good deeds, everything basically, intention is changed, your vision changes, and your motivation changes. And in the Sunnah, the Prophet ﷺ, he learned that we should be asking Allah for al-afiyah. We should be asking for well-being. Those of us say أذكار الصباح والمساء اللهم إني أسألك العفو والعافية. You're asking Allah for well-being. Why? Because when you have well-being, when you have al-afiyah, you have the energy to wake up in the morning. You have energy to perhaps pray qiyam. You have energy to lead your family, to go to work with positive mood and influences those around you. Or when you have al-afiyah, you're able to, pray Tarawih or fast Ramadan without having to worry about any ailment, migraine, headaches, medication. And really a very, very profound hadith is the Sunnah of the Prophet ﷺ. And in fact, in many of my lectures, even at Master mentioned many other workshops, when I mentioned this hadith, I had the audience pause for a moment and allow it to be, because it's really deep. And so the Prophet ﷺ said, من أصبح منكم ضعافا في جسده آمنا في سره عنده قوت يومه فكأنما حيزت له الدنيا. Whoever amongst you is physically healthy, feeling safe and within himself, with food for the day, it's as if he acquired the whole world. And so when you wake up feeling healthy, you wake up, there's no pain, there's no joint pain, there's no migraine, so you're not having to worry about these conditions. It's a huge blessing that many of us forget. When you're feeling safe and secure, another blessing you probably don't even have to think about. When was the last time you had to wake up and say, am I safe? Is my children alive? Am I alive? Is my spouse safe? have to worry about that. SubhanAllah, many of our brothers and sisters around the world, Allah subhanahu wa ta'ala alleviate their pain and their suffering and their hunger. They have to deal with that every day. Another blessing. And just having food for the day. We know what we're gonna have tomorrow. We plan next week. Let's go eat this food. Let's go have this. This restaurant has. They make good biryani. Or this restaurant has good. Perhaps we plan ahead and ahead, or we store our pantry. The expired months to come. Not that I recommend anything that expires many months later. It's as if it expired the entire world. SubhanAllah. And so, that gives us gratitude. And are we grateful for this blessing? And are we taking care of the amana of our physical health? As the famous poet says, العبد ما أولاه من نعماه في رزقه. So out of gratitude to Allah subhanahu wa ta'ala, you use this physical health and your well-being as this amana that you are showing Allah, I'm going to use it in a way to I'm going to take care of this amana and use my body to, perhaps serve the and what I consider the elevator speech of all my health because I cannot sum it up better. It's actually a quote that's what he's doing, the forward of my book. And so he says many people are looking for a pill to everything. A pill for weight, a pill to feel happy, a pill for depression, a blood pressure, a blood sugar pill, etc. But there is no such. The secret is in the way Allah, our Creator, has intended for us. And that takes us into the point that the Quran and Sunnah are our blueprint. So the last time you bought your child for example, in toys, Legos, or perhaps it's now iPhone and electronics, or whatever it may be. There might have been a time when you couldn't, get something for work, or you were questioning, how do I enhance this, or how can I upgrade this, how can I fix this, and you go back to the beginning. And the same way you're trying to use the tool or the toy or whatever it may be in the best way, or get the best out of it. It's the same with every aspect of it. So whether it's your finance, whether it's your relationship, or the way you deal with it, or the way you predict, or the way you take care of your health. There's unquestionably the Quran and Sunnah our book. So if you want prosperous health, I have clients come to me and people come to me and say, well, I tried, this diet, I tried keto diet, I tried paleo, high carb, low carb, pizza diet, cauliflower diet, whatever it may be, every single diet, short-term diet. And subhanAllah, the results are very short. Right? Many times they're very short, the results, especially when the diet is short-term. Go on a 3-day diet and then you go back to your old habits. But really, what I recommend for everybody is do a Sunnah. So when we go back to the Quran and Sunnah in every single aspect of our life, this is the only time we will truly find success in the dunya. We will have the ultimate health. We will have the ultimate, barakah in our wealth, our relationships, or whatnot. It's when we turn back to the Quran. And really today we look around, we're over, stressed, nutrient deficient, we're over caffeinated, energy shots here, and course stuff here and whatnot. And yet we're seeing more and more health problems. So we're seeing heart rate, heart disease, and stroke, and obesity, and diabetes. And the issue is it's coming in younger children. Not to say people never used to, but not at the the rate that we're seeing today, the trifold rate, occurring in younger generations. So one might ask what happened. Unquestionably, we have went further away from the Quran. Allah tells us, for example, it has shifa, but we wait for a scientist, a white coat to tell us, oh, this is actually good for you. You know what? We take that back. It's time. We turn, these two blueprints in our life systems, we will have all. Allah subhanahu wa ta'ala tells us in the Baqarah, يا أيها الناس كلوا مما في الأرض حلالا طيبا ولا تتبعوا خطوات الشيطان إنه لكم عدو مبين. All mankind eat whatever is in the earth that's awful and that's good. So halal, it's free of it. Halal is that which Allah has made halal for us. This is for us. So that means you avoid things with sport, you avoid things with jealousy, you avoid things with alcohol and whatnot, as forbidden for us. And so one might ask, so is tayyib just for? Is tayyib just for? Actually, according يقول الإمام ابن كثير طيبا أي مستطعبا في نفسه غير ضارا للأبدان ولا للعقول. So this tayyib is مستطعبا, it's good, it's beneficial for your physical and your mental well-being. And many research now come across foods, for example, that are bad for your mental health. They're known to, for example, cause mood, cause strength. Take a day where you wake up and you have a lot of sugar, perhaps empty carbs or rice or whatnot, and your mood is down. Because you're literally altering the neurotransmitters of the brain. In another workshop I do called Food, Faith, and Happiness, all about the effects of the food you eat on your mood. So, for example, eating foods that are known to boost your neurotransmitters, like healthy fat, olive oil, omega-3 fatty acids, fatty fish, etc., directly linked to your mental health. And so we're learning from the tafsir of this ayah that طيبا is that which is good for your physical and mental health. So unquestionably, once we set this foundation that yes, as a Muslim, I should care about my health. Why? Because it affects my ibadah and it can allow me to, with obviously with the permission of Allah subhanahu wa ta'ala, and this qadr, to live a longer and healthier life in order to worship. Thus, I am fulfilling the ultimate purpose of my existence, which is to worship Allah subhanahu wa ta'ala. So, because I get often, especially from people who oh, shouldn't I just focus on my ibadah? Shouldn't I just worry about praying? But now we're learning that the food you eat has a direct effect on your health, which isn't related with your well-being. As the Prophet sallallahu alaihi wasallam told us in the famous hadith, نعمتان مغبون فيهما كثير من الناس الصحة والفراغ. There are two blessings which many people lose. They are health and free time for doing good. And unquestionably, they're interrelated, like we just mentioned. Now that for example, take Ramadan. When we're fasting all day, and then we come for Iftar and we have a lavish Iftar party. We're having that, and then cilantro sambusa, and then dessert, and 3 or 4 desserts even. Then we're like, oh, we have to have a cup of tea. And then we get up, pray for Tarawih, and the Imam says, Allahu Akbar, and then we say, Bismillah Allahumma amutu ahya. The supplication to go to sleep. Because of how exhausted and sluggish over. And so unquestionably, the food that we consume, the drinks that we have, our lifestyle, our sleep habits, all have a direct effect on our ibadah, on our spiritual state. In another hadith, the Prophet sallallahu alaihi wasallam tells us, "لما أنزل الله الداء إلا وأنزله الدواء علمه من علمه وجهله من جهله." That Allah subhanahu wa ta'ala did not send down any disease except that He sent down a cure for it. And whoever should seek that knowledge will seek those who are ignorant of our This teaches us that we should, when we know of a new medicine, or perhaps if we're dealing with a certain condition, we should seek medicine. We should seek help in curing for whatever ailment we are dealing with. Whether it's allergies, whether it's a headache, a migraine, and we're seeing more and more issues, coming up now with, for example, celiac, just gluten intolerance, severe intolerance, soy, all these different allergies coming across because of the way we consider today. And so we begin, allergies. And when I was given this topic, I actually did extensive research coming to learn that Texas is, in fact, one of the worst states when it comes to allergies, which explains a lot about this topic. So I promise you my number one advice will not be that you have to evacuate Texas, but it will be that, inshallah, we're going to dive into certain foods, certain habits that you can do in order to, inshallah, reduce or prevent your allergies altogether. Allergies are basically, the scientific definition of an allergy is a bodily reactivity, hypersensitivity, to an antigen in response to a certain factor. So it's an exaggerated or pathological immunological reaction. Your body is reacted by sneezing, perhaps a headache, a migraine, itchy eyes, watery eyes, whatever it may be. So all jargon aside, in other words, an allergy is basically reduced hypersensitivity in your immune system.
grass and so on. And the Sahaba from Mecca, when they moved to Medina, it wasn't easy for them to get accustomed to this moisture in the air and also to the pollen and the new climate that they're moving into right now. Even though people, they think Mecca or the Arabian Peninsula is all desert, but it wasn't the case. So when they moved into Medina, radiallahu anhum, a lot of them start falling ill and sick, many of them. In one incident in the hadith of Aisha radiallahu anha, when she said that in one incident, her father, Abu Bakr as-Siddiq, and Bilal, another Sahabi, they were all in one room and they're all suffering from sicknesses and illnesses. Some, they say it's actually fever, malaria, and other things, but a lot of these symptoms can go to the subject of allergies. So Abu Bakr as-Siddiq, when the Prophet ﷺ was asking him, how are you doing? He will just be reciting poetry, like said, I wish I could go back again to live in Mecca. I wish I can go back between the shrubs and the herbs, instead of saying the trees and the palm trees, because I would like to live between the shrubs and the herbs, just basically in the basic kind of environment of Mecca. So what did the Prophet ﷺ do? He did two things. Number one, made dua. And the dua that he asked Allah subhanahu wa ta'ala, Ya Allah, Allahumma barik lana fi madinatina. Ya Allah, put a blessing and barakah for us in this Medina, kama as you made barakah for Ibrahim alayhi salam in Mecca. That's number one. He did then also say, Allahumma habib ilayna al-madinata, habib madinata ilayna ka Makkata aw ashad. Ya Allah, make this city more beloved to us than Mecca it was to us. So like Allah, make us love this city more than we lived Mecca. And then he asked Allah, Ya Allah, remove al-humma, which means fever, or in this case, the allergy of the situation. Move it out of the city into the suburbs or outside of the outskirts of Medina. So Allah subhanahu wa ta'ala kind of like protecting al-Medina from that. Now, obviously, we don't have the same power of the Prophet as making a dua to remove allergies from Texas or Dallas or even from Irving, for example. But we make a lot of dua to Allah subhanahu wa ta'ala to give us recovery and healing all the time. That's the first thing. The second thing the Prophet ﷺ did, he actually did something interesting. When he was visiting the ill at the time, he, salawatullah wa he would say, Bismillah. And then he puts his finger on his tongue, he puts some moisture on his tongue, and then he puts it on the ground to touch the soil. And then with that dust or that dirt that sticks on his finger, sallallahu alaihi wasallam, he would wipe over the sick where it pains them. For example, if there were injuries or even they had fever, he would wipe it over their head, sallallahu alaihi wasallam, and he would say, Bismillah, biriqati ba'dina, wa turbati ardina, bi'idhni rabbina, yushfa saqimuna. He says, Bismillah, in the name of Allah. It's basically like saying dua, Ya Allah, by the moisture, which means the saliva of towards one another, and the soil of our land, by the permission of Allah Azza wa Jal, the sick will be healed. Now, it's a very interesting dua, right? First of all, saying Bismillah. Second, using saliva. Number three, the soil. And then number four would be the healing process. So how is this all possible? Ibn Qayyim al-Jawzi rahimahullah, in his book At-Tibb al-Nabawi, he explained that. And he said, the meaning of this hadith, it said the Prophet ﷺ begins, obviously, everything is by the name of Allah Azza wa Jal. So if you would like to looking for healing, you have to look for it in the name of Allah subhanahu wa ta'ala, first and foremost. Ruqya. The ruqya is very, very important. And ruqya means to recite the words of Allah subhanahu wa ta'ala, the Quran over your body. When the Prophet ﷺ used to ache, he would recite the Quran and wipe over his body. He does the same thing again for his children as well. And for Al-Hasan or Al-Husayn, he would recite the two quls and blow on them, salawatullahi wa salam alayhi. So he would blow his breath, which means that's saliva basically, his breath on his grandchildren, salawatullahi wa salam alayhi. Also, in addition to the ruqya, he says, riqatu ba'dina biturbati ardina. Now pointing it to the soil of our land. What does that exactly mean? Doesn't mean you need to grab, the soil and the dirt and just spread it in the house and put it in the food and to feel healing. No, that's not the point. The point of Ibn Qayyim rahimahullah is saying that there is barakah in the soil, meaning there is a power of healing in there through the herbs and the vegetation that grows in this land. This is why if you're looking for now medication or looking for healing from the allergies in Dallas, what do you need to do? Look for the herbs that grow in the Dallas area. Look for this, and that's what you use for healing. A lot of people, if looking for healing, what do? They go over, they go overseas. They bring all the herbs that they have in their hometowns. So some people, they go to the mountains of Pakistan. They collect every herb from everywhere, dry them up, and then bring them here to use them for, in a tea or something like that. It's good. There's no doubt about it. There's, alhamdulillah, there's benefit in there. But what's more beneficial is actually what you get from the local area. So the herbs of the land are very important. Also, in addition to that, the honey. Sunnah of the Prophet ﷺ to use the honey. And the honey has the power of healing. Allah mentioned in the Quran as shifa as well, being healing. So which honey is the best honey? A lot of people, they're proud of the honey that they make in their own hometowns or their village. So they always ask their relatives, hey, bring honey with you. But the best honey that you should really look for benefit and healing through is the local honey. And the more local the honey it is, the better for you. So if you would like to buy honey here in Texas, for example, look for the local honey. If you can find local farms around you, then this is the best honey you could actually use. If you couldn't find it locally in the area, at least surrounding areas, the small towns, the small countrysides around the city where you live. And then the state. And then if you would like, you can go after that. But the best honey is the more local, the more important it is for you for healing. Why? Because again, the bees will be taking the nectar from the flowers of the land. So all the herbs and all the flowers and all the trees will be beneficial to you. And we heard about the many things that happens here in Texas. The grass allergies and the oak and all that stuff and so on. And subhanAllah, when the bees goes and feeds the nectar from the flowers of these trees and put it into, by the blessing of Allah, into honey, that's a power. That's a healing over here, medicine in there. So that's the meaning Ibn Qayyim rahimahullah is referring to them. The Prophet says, "Bi turbati ardina," the soil of our land. So look for the herbs that grow into your land and try to benefit from this, inshallah ta'ala. Then he says, "Bi-idni rabbina yushfa saqimuna," by the permission of Allah subhanahu wa ta'ala, the sick amongst us will be healed and will be cured. So everything happens by the will of Allah subhanahu wa ta'ala and by the blessings of Allah azza wa jalla. That's something we have to understand. We have to keep in our mind, inshallah tabaraka wa ta'ala. The last thing I want to mention here is that the Sahaba radiallahu ta'ala anhum, when they first, to show you how difficult it was on them, when the Sahaba moved from Mecca to Medina, the environment was so hard and difficult on them, they were falling ill, and the women were unable to conceive. So they couldn't have even children, they would have miscarriages. So the rumors started spreading that the Muhajirin, in a short time, they'll be exterminated, like khalas, and they're going to die, they're not going to procreate, and that's it, they're done. So we're going to be done with these people. Allah subhanahu wa ta'ala blessed the Muhajir with the first baby that was born in Medina for them. And that was the child of Asma radiallahu ta'ala anha. When she gave birth to her child, Abdullah ibn Zubayr in Medina, he was mostly, you could say, like the most celebrated child among the people of Medina at that time. Why? Because that means, alhamdulillah, khalas, that means we're safe, we're good. If the lady was able to conceive that child there, alhamdulillah, and give delivery to that child, healthy child, that was okay, alhamdulillah, rabbil alameen. So it was actually a very well celebrated, event for them during that time. And the last thing I want to mention here is that when the Sahaba lived in Medina long enough, a lot of the people of Mecca, they said, you know what, Humma al-Madina anhakathum. Like when they come to you, they're going to come very weak because they were destroyed by the environment in Medina. So when the Prophet went for Hajj, for Umratul Qada on the 7th Hijri year to do the Umrah, the people of Mecca, they left, part of the deal is that they will evacuate the city of Mecca for the Muslimin for 3 days and 3 nights, in which they will make Umrah, they will spend there for the Ibadah, and then they will go back again to Medina. So the Arabs of Mecca, they evacuated the city and they went into the mountains. And they were watching the Sahaba as they were coming into the Haram to do their tawaf. So the news were spreading that the people of Mecca expecting the Muslimin to come very weak. So the Prophet ﷺ, he said to the Sahaba, قال رحم الله امرأ أراهم منا قوة. May Allah have mercy on someone, show them power. Like show them the might and power we have. So what he did, ﷺ, he uncovered his right shoulder. You know when you go for Umrah, for the men, and you reveal your right shoulder, you put the ihram, underneath. And the first 3 rounds around the Kaaba, they did al-khabab. Al-khabab, which is basically like marching. You know when the military march, when you stir the dust you don't just walk, you literally march. So the first 3 rounds were marching to show the people of Mecca the power of the Muslimin. So when the people were watching that, they go, Wallahi ma bihum min ba's. They're just fine. There's nothing wrong with them. Like there's absolutely nothing wrong with them, which means even though they went through the process of going through allergies, but at some point the body starts acclimating with it and getting used to it and producing, alhamdulillah, antidotes, and eventually, hopefully, that they will heal. So these are just some incidents, and there is more actually to the Sunnah of the Prophet sallallahu alaihi wasallam. But if anything, I would recommend from the Prophet sallallahu alaihi wasallam's practice is the dua, al-ruqya. So you're making the dua and supplications to Allah subhanahu wa ta'ala. There's a ruqya, there is citation of the Quran, especially the mu'awwidat, قُلْ هُوَ اللَّهُ أَحَدْ قُلْ أَعُوذُ بِالْفَلَقِ قُلْ أَعُوذُ بِرَبِّ النَّاسِ, and Surah Al-Fatiha 4 times as well to be recited. Also from the example of the Prophet ﷺ is the use of what is common in the land, the herbs of that land. Look what is here considered, has any kind of, medical value that can be used, inshallah, through alternative medicine. And subhanAllah, interestingly, I just actually acquired a book that has all the vegetation and all the shrubs and the herbs that grows into Texas. So if anyone wants to learn some about stuff, I have the book already. And it has everything, and has all the value of these herbs and what they are for and all that stuff. SubhanAllah, it's very interesting. Now, all what you need is just take that book with you and go on a hike and start, exploring, so that you know what you're picking. Don't pick the wrong one, okay? And it teaches you which one is actually you can eat, which one is edible, which one is not, and so on. So it's an interesting, actually, finding, subhanAllah, expertise in one single book. From the Sunnah of the Prophet ﷺ, using honey, and use honey as you use it for medicine. So obviously, before you do that, I hope that you can ask the doctor, so that you don't go and take the wrong thing, and might affect you. So make sure that you do that, inshallah, tabaraka wa ta'ala. And anything else that was prescribed in the Sunnah of the Prophet ﷺ, I hope you can check the book of Sister Noor, inshallah ta'ala, the Sunnah Superfoods, where she puts all the ingredients from the food of the Prophet sallallahu alaihi wasallam, and hopefully, inshallah, you can find good recipes to keep you healthy, not just during the season of allergies, but throughout your lifetime, bi'idhnillahi tabaraka wa ta'ala. Once again, I want to apologize for you and for our Sister Noor for being unable to broadcast this here because of technical difficulties, but inshallah, I hope you can check it out online and listen to her talk with Allah Azza wa Jalla. Hopefully we can make it up for her, inshallah, and hopefully we bring her live here to be with us, inshallah, at one point, bi'idhnillahi tabaraka wa ta'ala. With that being said, if you guys have any question, we're still here, inshallah ta'ala, bi'idhnillah Azza wa Jalla, for a few more minutes. Any questions, Jama'ah? Otherwise, I'm going to be looking on the online questions. Please.
So, inshallah, I'd like to mention something that I should have to that line of discussion is that that the local product, local honey, versus those herbs that triggers allergy reaction is actually very practical, because that's how a lot of times the allergy is treated. When somebody is allergic to some daily ordinary stuff that they need to overcome, and a lot of times allergy specialists, they give specific allergy shots, injection, and those are basically making your body to desensitize to that. So they start with a low dose, low dilution of that injection, and then progressively they increment the dose to a point that your body progressively gets desensitized to that. So that's a great example. And another last thing I would like to mention, that a lot of times some of us react too much to seasonal allergy. So that's why there is a medical term. It's called rhinitis medicamentosa, meaning overwhelming use of anti-allergy medications. Some people go crazy. They use medications, inhalers, tablets, and they're like, oh, I cannot take this anymore. So what do you have to do? For those individuals, just stop everything. Because whenever you use those short-acting antihistamine, epinephrine, all these things that's available over the counter, and they transiently make you feel better for 2-3 hours, and after that, it's called rebound congestion, meaning your congestion comes back, and when it comes back, it becomes even worse than the initial encounter. So for those individuals, when you are allergic, you suffer, and you're using a lot of these products, just stop them. Just take a break, relax, and eventually it's going to get better. Jazakallahu khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah khair. Once again, Jazakumullah khair. the week after, Binillah Azza wa Jal, with special program. We're going to announce it later, inshallah. And the program is going to move to after Maghrib, because Maghrib is going to be around 7:30. So we're going to we're going to move the class, inshallah ta'ala, after Maghrib, starting, inshallah, the third week of March. We see you then, Binillah Azza wa Jal. Jazakumullah khair.